Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is September 11th, 2020. As always, we'll start with our COVID-19 statistics. Worldwide, we have over 28.5 million cases, as well as nearly 920,000 deaths. In the United States, we have over 6.6 million cases and nearly 200,000 deaths. This week, we're going to try something a little different and start with the non-COVID news first, and then move into the COVID-19 news later on. First off, multiple areas throughout the United States have been experiencing record-breaking wildfires, especially in the West, California, Oregon, Arizona, Utah, Idaho. Those are the places where you have the most wildfires. There are a few in other states around there too. Some of the reasons for the fires being so bad this year are that we have hotter than usual temperatures, drier than usual conditions, including a 20-year drought in California. And also people are spending a little extra time in the wild so that they can social distance while still being outside. They don't want to be stuck in the house. So due to all the fires, San Francisco and the surrounding area actually had orange skies earlier this week. There's also a lot of ash falling from the sky in that area. Public health officials have warned people in areas that have the smoky, polluted conditions to please avoid breathing in the air. The best way is just to stay in the house. Cloth masks that we use for COVID-19 really don't provide much protection at all against the pollutants found in wildfires, the air from wildfires. Surgical masks may provide a little bit of protection, still not very much. N95 is a little better, but still, the best thing is just to stay in the house if you at all possibly can. Some local governments in areas close to the fires are actually recommending or even requiring evacuations. So if you're in that area, an area that's requiring those evacuations or even recommending only, please evacuate. Your life is much more important than your stuff. In recalls this week, there are 3 types of dog food that you should throw out or return to the store for a refund due to toxic mold found in there. The 3 types are on the screen and can also be found in the link below the video. A new study suggests that acetaminophen, also known as paracetamol in many other countries, and going by the brand name of Tylenol here in the United States, can increase risky behavior. The study showed that patients who were given acetaminophen were more likely to ignore danger in order to gain a perceived benefit. Other recent studies have also shown that acetaminophen can reduce empathy and decrease a person's ability to make correct decisions. Acetaminophen is a popular and readily available medication. You don't need a prescription for it or anything like that. And one major concern this research brings up is related to COVID-19. If people are taking acetaminophen for some of the COVID-19 symptoms, such as fevers or body aches, they may be more likely to take the risk of going out while infected with COVID-19 instead of staying home. And of course, that could result in higher number of cases, more spreading of the virus. So though these studies were fairly robust, using placebos, double-blind, things like that, they still need to be duplicated just to be sure. So for now, the recommendation stays the same. Using any medication, including acetaminophen, should be done only when needed. If you can allow your body to overcome it on its own, that's better. If you have a high fever that may become dangerous or something along those lines, then that's when you would want to start using the actual medication, whether acetaminophen or other ones. Climate scientists are warning that natural disasters, such as the wildfires and hurricanes that we're seeing this year, will continue to increase in frequency and strength. It's not just 2020 being a bad year. Previous years, for the last decade or two leading up to 2020, we've seen a gradual increase in the frequency and strength of natural disasters. Most of that was actually predicted by climate change models. No model is perfect, but the ones that we've been using have been close enough that current models for the future are probably pretty accurate. We do need to take steps to reduce global warming if we want to keep all those natural disasters from getting worse. We talked a bit about this last week when we talked about the ice sheets melting in Greenland and Antarctica, so please review that report for ideas on what you can do. So now it's time to talk about COVID-19. Some of you may remember a few weeks back when we had offered advice on who to listen to for COVID-19 advice. Our easy answer was listen to the CDC, don't listen to President Trump. Just like before, I want to stress this is not politically motivated. I don't care if you go to Trump, Biden, whoever for your political information. I don't care what your other beliefs are or anything like that. But the fact remains that President Trump has a terrible track record as far as getting anything right on COVID-19. This week, he had actually admitted that he downplayed the threat of COVID-19 even though he knew it was serious. There are actual audio recordings of him telling a journalist that COVID-19 is much worse than the flu, that young people also get it, that it's not going away anytime soon, and that it can be transmitted through the air, not just through touch. This was all said while he was telling the public that it wasn't dangerous, he was encouraging schools and businesses to reopen, and he was discouraging the use of face masks. So once again, this is not political, it's just trying to follow the science, trying to save as many lives as possible, trying to keep the entire world as healthy as possible. But please, do not follow President Trump's advice on COVID-19 unless it also syncs up with what the CDC is saying, which is rare, but it does happen. So once again, please, this is not political, but please don't listen to President Trump as far as COVID-19 is concerned. Continuing on, there are some reports of COVID-19 causing sudden onset diabetes. COVID-19 has shown that it can affect multiple parts of the body. And it's thought that diabetes, this sudden onset diabetes, is caused by infection of the pancreas by the COVID-19 or by the virus that causes the COVID-19. COVID-19 has also been found to be able to infect the brain, but it's thought to be pretty rare. Many COVID-19 patients have experienced neurological symptoms, but not all of those symptoms would have to be caused by a brain infection. Symptoms such as strokes could be caused by issues in other parts of the body, causing blood clots to travel to the brain. Same thing with a lot of other neurological issues that we're seeing. They could be caused by other things in other parts of the body just affecting the brain. The Sturgis motorcycle rally is still in the news this week. An organization ran a statistical analysis which suggests that the rally could have caused over 250,000 total cases and $12 billion in health costs. The South Dakota governor, of course, pushed back against this analysis, as well as many other people pushed back against it. And it's currently unclear how accurate the analysis is. As with any analysis, there are a number of assumptions that have to be made just to be able to do the calculations and everything. And so we're not sure if the assumptions are correct. But even if it's only half of what they say in their analysis, that's still a huge amount. Many who challenged the accuracy of the analysis pointed to another analysis done by the same company that said that the Black Lives Matter protests had almost no effect on the number of COVID-19 cases. And honestly, when they came out with that first analysis on the protests, I also questioned the accuracy of it. But now that we know a lot more about how this virus works, it actually makes a bit of sense. Let me just explain a little bit why. Protests are held outside. That automatically makes it less dangerous. Of course, there's still an issue with the social distancing, not wearing face masks, things like that. And so we would expect to see some effect from those protests, but not anywhere near as much as with Sturgis. The Sturgis rally, oftentimes we think of a rally as something that's held outside, and a lot of the Sturgis rally is outside, but a large portion of that rally is people actually spending time together in bars and restaurants. In fact, the CDC reported just this week that people in the United States who tested positive for COVID-19 were more than twice as likely to report eating or drinking at a bar or restaurant in the past 2 weeks. Other activities, such as going to church, shopping, or working out at a gym, were much less likely to result in becoming infected by the virus which causes COVID-19. This is likely due to more easily being able to wear masks and or social distance during those activities. It seems that bars and restaurants are some of the most dangerous locations for spreading the virus. That makes sense since there are typically many people in a small enclosed space who are not wearing face masks, since that would interfere with eating and drinking. A lot of talking, it also usually happens at bars and restaurants, so the virus has a high chance of being expelled in large amounts. As we talked about in the previous report, bars also have the additional risk factor of people drinking too much and losing some or all of their inhibitions that they may have had beforehand that would have protected them from COVID-19. So that all goes together as to why the Sturgis rally would have a much higher impact or a much higher effect on the number of cases than protests would. Another reason why the Sturgis rally would have that higher chance of spreading COVID than the protests is that the protests that were analyzed were from earlier on in the pandemic. At that time, we didn't have anywhere near as many cases as we do now, and so there just wasn't as much virus being spread around. Sturgis rally happened recently, just a few weeks ago, and the overall case numbers are much higher. Many more people throughout the United States actually have the virus, and so there's a higher chance that people can get it. We assume that if an analysis were done on the protests today, that it would show a higher amount of spreading of the COVID-19 than it did in the past. But because of the fact that it's held outside versus Sturgis, which was mostly inside, in bars and restaurants, it still probably would not be anywhere near the amount of effect that the Sturgis rally had. In vaccine news, AstraZeneca, one of the major companies for creating vaccines, has temporarily paused their phase 3 trials because a patient started to experience severe neurological symptoms. The patient received medical care and is recovering quickly, and chances are the patient's symptoms probably weren't caused by the vaccine. We don't know for sure, and that's why AstraZeneca paused their trials. They wanted to be sure before giving out additional doses, etc. And so they're doing that research, trying to figure out what exactly caused those neurological symptoms for the patient. The pause in the trial of the vaccine is actually positive news. If you remember last week, we mentioned that the vaccine may be made available early, and we expressed concern about the release of the vaccine being politically motivated instead of motivated by science. This pause shows that companies that make vaccines are serious about providing a safe, effective vaccine and not just rushing something to market. In fact, 9 of the world's major vaccine companies issued a pledge last week that they would make absolute certain that their vaccines are safe and effective even before seeking government approval. The NIH director, Francis Collins, also said that the release of a vaccine would follow the science or he would have no part of it. All of this is extremely important for a few reasons. First, we want to have safe and effective vaccines. There's no point to a vaccine that doesn't work or to a vaccine that causes more trouble than it fixes. Second, there's also no point to a vaccine that no one will take. If people believe the vaccine was rushed and may be dangerous or ineffective, they won't take the vaccine and we won't achieve the herd immunity that we're trying to get. Finally, pharmaceutical companies need to regain the public's trust. Many people don't trust what they call big pharma because they're just seen as being in it for the money. And that some of that reputation is deserved, but much of it is not. Vaccine makers know that if they mess up this vaccine, the fallout will be huge. That's why they're highly motivated to get it right instead of rushing it. Thank you for watching the Plain English Public Health Weekly Report for September 11th, 2020. For even more public health news, please see the many links below the video. Please also join with us in observing Patriot Day today and remembering those who lost their lives 19 years ago. We're especially grateful for those who sacrificed to save others during that terrorist attack. I'm Richard Greenland, and you have a healthy weekend.